So how do we diagnose this condition called adenomyosis? Adenomyosis is diagnosed on ultrasound, based also on suspicion that there may be adenomyosis based on the patient's symptomatology. So if the patient is having adenomyosis, commonly they have severe pain during periods, they may have very heavy bleeding, they may have a constant chronic lower abdominal pain. 30% of patients, adenomyosis condition is associated with endometriosis, and that is the reason why when we do an ultrasound and diagnose adenomyosis of the uterus, we also look for associated endometriosis in the pelvis and in the ovaries. So how do we diagnose adenomyosis on ultrasound? If the uterus is enlarged in size, if the uterine walls are asymmetrical in thickness, that means there is an anterior wall, there is a posterior wall, and if one wall is larger and thicker than the other wall, that is, it's not symmetrical, we know that the patient has adenomyosis. We also look at the texture of the uterine wall. Is it a homogeneous ecotexture? Is it a heterogeneous ecotexture? Because when there is a very heterogeneous, uneven texture of the uterine wall, again we know that the patient is having adenomyosis. So these are just simple pointers which tell us on ultrasound that the patient is having adenomyosis, and based on the patient's symptoms, age, desire for pregnancy, we then offer treatments like medical management or a Marina insertion or a microwave ablation therapy of adenomyosis or a total laparoscopic hysterectomy based on the patient's situation.